What if I told you that the man or the woman behind that 18-wheeler that you just passed is more likely to have depression than you are? Hi, my name is Tandra from TS Hill Logistics. Today we're going to talk about something that I don't hear talked about in the trucking industry much. Before we dive in, let me be completely transparent with you. I myself suffer from depression. So this information isn't just for the drivers, it's for me as well. We're in this together. Now let's talk about some statistics. According to peer-reviewed research published in Social Psychiatry and Psychiatric Epidemiology, 13.6% of drivers suffer from depression. That's more than double the rate of the general population at 6.7%. But it gets worse. A study in the International Journal of Environmental Research and Public Health found that 22% of truck drivers report being diagnosed with depression. A 2020 study revealed that 44% of long-haul drivers experience symptoms of depression. Think about that. Nearly 1 in 2 drivers on our roads are struggling with mental health issues. The same research shows that 27.9% suffer from loneliness, 20.6% have chronic sleep disturbances, and 14.5% battle anxiety. These aren't just numbers on a page. These are our colleagues, our family members, our loved ones. They're the most important part of our economic system. They move the supply chain. So now we're going to go through 3 root causes of depression in drivers, and I'll also give some solutions to these problems. Root cause number 1 of depression in drivers is loneliness. It's isolation and social disconnection. According to research from Canadian and American long-haul truck drivers published in Science Direct, stress due to being away from social relationships has the most positive association with depression. We're talking about drivers spending weeks away from family members, missing birthdays, anniversaries, and just basic human connection. When you're alone in that cab for 11 hours a day, your mind can become your worst enemy. So here's the solution. The same studies that found this information show that if you keep regular contact with your family members, this can dramatically reduce your stress and anxiety and depression. Schedule video calls with your family, not just text messages, but actual face-to-face interaction. Connect with fellow truck drivers at the truck stops. Building community with people that understand your challenges can break that isolation. Use technology. Apps that let you watch movies together remotely or play video games together with family while you're on the road. The key is intentional interaction, not just random check-ins. The second root cause of depression in drivers is severe work-related stress. Research published by the PMC, which is PubMed Central, found that drivers with severe work-related stress were 3.7778 times more likely to experience depression symptoms. This isn't just about tight deadlines, even though that matters. This is about unrealistic expectations, hidden fees, dispatchers that treat you like you're not a business owner, and the constant pressure to perform in an industry that often doesn't respect its most valuable asset, which is you. The same research identified that drivers who had more control over their work environment and better relationships with their management or their employees showed significantly lower depression rates. Here's some practical steps. Choose companies that practice transparent communication. Know your rate confirmations up front. Work with dispatchers that respond the same day, not next week. Demand respect in your business relationships. You're not an employee, you're a business partner. Set realistic expectations with your dispatch. Let them know how many hours a week you want to work, what kind of loads you want to run. Make sure that you are taking care of you first and foremost. This is exactly why I built TSO Logistics around transparency and respect, because your mental health matters more than any load. The third cause for depression in drivers is sleep deprivation. The PMC research found that drivers with broken sleep patterns were 5.148 times more likely to develop depressive symptoms. So we're not just talking about getting fewer hours of sleep, like getting 8 hours of sleep versus getting 6 hours of sleep. That matters, but what matters most is the quality of your sleep. Dealing with sleep apnea affects 28% of drivers, and the constant disruption of regular sleep cycles that comes with irregular routes and schedules. Poor sleep doesn't just make you tired, it literally changes your brain chemistry and makes depression more likely. The solution: evidence-based sleep interventions show remarkable results for driver mental health. Practical steps: create a consistent sleep schedule, 7 to 9 hours when possible. Make your cab a sleep sanctuary. Blackout curtains, comfortable mattress, temperature control. Develop a pre-sleep routine. No electronics 30 minutes before bed. No drinking 45 minutes before bed. Just things that will help you have a full night of sleep. Some added things to help: take breaks whenever you're feeling fatigue, because your mental health and your safety depends on it. If you do get a full night of sleep and you still feel a little tired, get tested to see if you have sleep apnea. Better sleep equals better mental health. Okay, I want to be honest with you. I started TS Hill Logistics because I've been where you are. I know what it's like to feel overlooked, disrespected, and stressed to the point of breaking in this industry. My own battle with depression has shown me that we cannot continue to treat mental health like a weakness or something to hide. It's a medical condition, just like diabetes or high blood pressure, and it deserves the same attention and care. If you're watching this and you're recognizing yourself in these statistics, you're not alone. You're not weak, and there is help available. I'll include some resources at the bottom of this video. The trucking industry has a mental health crisis, but it also has something else. Drivers who are tough, resilient, and willing to support each other. At TSO Logistics, we believe that transparent, respectful dispatch services aren't just good business, they're essential for driver mental health. Because when you feel valued and respected, everything else gets a little easier. If this video helped you, share it with another driver. Let's start talking about mental health in trucking, because the first step to solving any problem is admitting that it exists. Drive safe, take care of yourself, and remember you matter. Subscribe for more content about mental health in the trucking industry, and let me know in the comments what mental health topics we should cover as it relates to trucking.